Nearly 2 years into this global pandemic, and nurses at public hospitals in New York City are still saying they don't have what they need.
Our emergency rooms are overflowing. Just this week here, we've had upwards of 40 patients waiting for beds. And with the current crisis with COVID, it's just adding more and more of a strain.
Outside Jacobi Medical Center in the Bronx, nurse after nurse after nurse described the conditions they endure on a daily basis.
I'm expected to be a med-surg nurse, an ICU nurse, a trauma nurse, an ER nurse, a pharmacist, a preceptor, and I simply can't. I can't do it.
Overcrowding, delays, and lack of resources are forcing many to resign.
Why are the nurses leaving? Because we're tired. It's not because we don't want to care for our patient. We're tired. We can't take it anymore.
The nurses say they were barely able to accommodate the victims from Sunday's deadly fire that killed 17 people and claim they have to return to work despite showing COVID symptoms.
Nurses are being, quote unquote, advised to return to work, yet they're still symptomatic. Yet they're still expected to care for your dad, your mom, your sister, your brother, your daughter.
Money is a temporary solution, they say. Instead, they're calling for a change in the healthcare system.
In New York, we need to pass the New York Health Act. We need single-payer health care. Across the country, we need Medicare for all.
The New York Health Act would provide universal health coverage to every New Yorker.
We need our government officials at the federal, the state, and the city level to step up and help our nurses.
And the New York Health Act is currently in the Senate committee. Elected officials say it could be up to 6 months until any progress is made. But nurses say they need the help now. At Jacobi Medical Center in the Bronx, Michelle Ross, Pix 11 News.
And we did reach out to Jacobi Medical Center for comment. We will let you know if we hear back.